Hello and good evening, and welcome to the Functional Medicine Solution class and podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and with me we have Dr. Esha.
Hello.
And every Wednesday evening we join together to talk about the most current and updated new research and to talk about the root causes. So if you want to learn more about the root causes of chronic diseases and integrative and functional medicine strategies to help your patients to improve their health, you are at the right place and at the right time. And I asked Dr. Esha to join us because she's got years of clinical experience as a functional medicine physician. And so we're going to join forces. I'll bring my clinical experience. Dr. Esha is going to bring her clinical experience. And what we really want to talk about today, this is a fascinating topic that we're getting more and more data on, and how it's so important for healthcare practitioners to understand this topic and how it relates to chronic diseases. And this is where we're going to talk about personalized gut therapy. And we're going to talk about the differences between probiotic, symbiotic, and focus a little bit more on postbiotics. Now, probiotics, we know that there is so much information going out there on the internet about what probiotics are. You probably encountered so many different types of probiotics on the shelves in the natural stores or Whole Foods or or online. But what we really wanted to talk a little bit more today is about the postbiotics. Now, we're going to dive deeper into understanding what are postbiotics exactly, what are their therapeutical role in the clinical setting, how you can use postbiotics as a safe and effective method of improving your patient's health and function. And we're going to talk a lot about their powerful role in not just gut health, but also immune balance, chronic inflammation, preventing and reducing the risk of chronic inflammation, and metabolic function. We're also going to talk about how they're related to so many medical conditions. And this is such an important topic because we have more data today than we ever had before about the importance of the gut microbiome and how through changing the gut microbiome, we can modulate our immune system, we can impact our metabolism and body weight, we can reduce the risk of so many conditions. And this is coming out after we have seen already so many different studies coming out on the impact of just giving patients probiotics, right? Patients that might have autoimmune diseases, IBS, or metabolic issues such as type 2 diabetes, right? So this is such an important topic, and unfortunately, it's really not taught much in medical or nursing schools. So we wanted to share this with you, right? And the importance is that if you understand, the more you understand the gut microbiome, the more you understand the methods of evaluating and evaluating the gut microbiome composition. And today we're also going to talk about the postbiotics, which is another side to looking at the gut microbiome that really explains majority of how our gut bacteria can lead to such a significant impact in all these different studies. When they give a patient probiotic, the group gets placebo or the control group, and then we compare the results and we see that probiotics have a real impact on the physiology of the patient. So, Dr. Esha, this is such a fascinating topic.
Yes, I agree. It's so fascinating. And just there's so much new research coming out on a daily basis about the microbiome and things we never knew about this kind of organ system of its own. So it's really cool when you think about we're mostly bacteria. We have more bacteria than we have actual cells, right? So we're mostly bacterial organisms, which is kind of cool, but also gives us a lot of area as practitioners to target when we're looking at just the whole system in general. So I'm excited to take a deep dive with you today about postbiotics and the microbiome.
Absolutely, absolutely. And this is really what we do in functional medicine, right? Where in the conventional approach, or let's call it the standard of care, right? Most practitioners are trained to get a diagnosis, right? And then from there, here's a prescription, right? And then we send the patient home. And while that's very important for managing the patient's conditions or symptoms, we also, in the functional approach, we also want to ask ourselves what's causing the disease, right? And what else can we do to help to improve the patient's function, improve the patient's health and well-being in order for us to really get a long-term results, right? So take us into, maybe we should start with what does the term really microbiota means? What does it actually, where's it coming from? Right?
Yeah, totally. So the term microbiota dates back to the early 1900s when scientists discovered that trillions of microbes, bacteria, yeast, viruses live throughout the entire human body, including the gut, the skin, the lungs, liver, the mouth. These microbes are so influential that they're sometimes called the body's hidden organ because their genes outnumber our human genes by more than 150 to 1. So we're going to take a look at this picture from the Journal of Signal Transduction and Targeted Therapy. Now, although microbes live throughout the body, including the lungs, the mouth, the skin, the vagina, the gut actually hosts the largest and most studied community. So the mouth comes in second with its own diverse and active microbiota that plays a key role in health. So while the terms microbiota and microbiome are often used interchangeably, microbiota refers to the actual microbes, while microbiome includes their genes, their structures, and the surrounding environment. So for example, bacteria on the skin will help protect against infections. Those in the lungs influence immune responses, and the vaginal bacteria help maintain a healthy pH and prevent harmful infections. So the reason that I'm sharing this with you is because new studies are now reporting a connection between changes in the gut microbiome and bacteria in other areas of our body. For example, in a study published in Frontiers in Cellular and Infection Microbiology in 2022, the authors reported a possible relationship between the gut, vaginal, and uterine bacteria, and between dysbiosis and the development of several female reproductive tract diseases. And outside of that, I think about gut liver cases and the burgeoning incidence of things like liver disease, fatty liver disease, metabolic liver disease, and gut microbiome, how it directly influences the liver. So your gut shares these different axes with different aspects of the body. So the gut lung axis, the gut reproductive axis, the gut liver axis, and so on. So it's very, very influential.
Because essentially what we do when we go into the advanced and clinical functional medicine program, we go much deeper into the gut and the different aspects of the postbiotics that we're going to talk about today. We're talking a lot more about the different types of gut microbiome and how they're associated with diseases, right? But like you mentioned, there's also these axes, right? These kind of connections between the gut and the liver and how that impacts liver function, right? And then there's the gut kidney and the gut skin,
exactly. Mm-hmm.
Right? One of the most interesting ones are the gut brain and the gut cardiovascular axis, right?
Oh, yeah.
So this is where, and this is exactly how we designed the advanced program in a way that we first look at the entire gut ecosystem. And then once we understand how to test it, how to evaluate the mechanisms and what are the treatment protocols, then we go out and start exploring how would that impact a patient. If I got a patient with a cardiovascular condition, or I got a patient with a liver disease, or I got a patient with kidney disease, how can I impact their function through changing their gut microbiome, right? So important. and gives
Agreed.
Yep. And also gives the practitioners additional tools to help the patient instead of just giving them a prescription and praying for the best, right? Hoping for the best, right? It's really something to give us additional tools that new scientific evidence is just revealing now, which is incredible. So let's go. So Dr. Esha mentioned the gut microbiome is the largest, essentially the organ that hosts the largest amount of bacteria. So let's dive into a little bit more in the gut microbiome, because this is really going to be our focus for today. If you want to learn more about the other connections, then log into the Advanced Functional Medicine program, and you have all of that information, all of those classes there. So when we go into the gut microbiome, it's really important to understand the following concepts to understand how the gut microbiome really impacts chronic diseases or increase the risk for chronic diseases. So as Dr. Esha mentioned, we got a lot of bacteria in our gut. It's some estimations that we looked at were at 38 trillion bacteria, which is roughly as many human cells we have in our body. And it's really interesting because having a diverse range of gut bacteria helps to protect against conditions such as obesity, metabolic syndrome, or type 2 diabetes. And on contrast, if you have lower amount of microbial diversity, it links with several studies with weight gain, insulin resistance, and inflammation. This is really why we have this amazing program that is called the Functional Weight Loss Consultant. That's a certification program, which is 2 months just really dedicated to understanding what are the root causes, underlying causes of persistent weight gain and metabolic dysfunction and insulin resistance, right? Because we now understand that the gut is more important than we previously thought when it comes to weight gain, right? Now, it is true that you can give the patient weight loss medication or like a GLP-1 agonist, or the patient can continue to attempt to lose weight by calorie restrictions or dieting. But those we know that have reported possible side effects, right, with some of these medications. And we know that that's not really addressing the root cause in many cases. And so many patients go on diet and then they get the rebound, right, which is they gain the weight back as soon as they stop dieting or take the medication. So a long-term understanding, getting that understanding of what the gut microbiome in my body, inside my gut, do to help me is really, really important. How we can achieve this balance. And we're going to show you some really cool testing, lab testing, functional lab testing that you can look into. And we're going to talk about some really, really interesting treatment strategies. So let's take a look at the picture from a study published in 2023. This is on the gut microbiota functions. So the gut microbiota, as you can see here, there's multiple functions. These are just a few of the essentials that we wanted to mention, but it's essentially involved in the production of secondary bile acids, protein catabolism, the breakdown of protein and foods that we're eating, right? Carbohydrates, when we eat carbohydrates, the gut microbiome helps us to break down that food. There's also degradation of xenobiotics, so breaking down medication that we're taking, for example, production of water-soluble vitamins, which is really important. And then one of the very important functions is control or modulation of inflammation and immune response. This is especially important for patients with autoimmune conditions, cardiovascular conditions, patients with cognitive decline that could be due to neuroinflammation, right? So we want to constantly help our body to have a healthy immune response, right? Instead of an ongoing, immune overactivity and inflammation, right, which cause more damage. And then, of course, maintaining the intestinal barrier integrity is very, very important, because because we are exposed to so many different bacteria, we're exposed to so many different chemicals in our food and water, right? And so we want to make sure that those the bacteria in our gut and bacteria byproducts, and especially the different chemicals in our body, in our gut, do not leak into our body, right? So that's why the intestinal barrier is so important. And so apart from that, we also, which you can't see on that picture, they didn't mention that in that particular study, but also the production of postbiotics is really, really important. We're going to get more into that later on. But for now, I want you to ask yourself, what happens if my gut microbiome shift, right? So that could be, for example, that could be a situation in which we have less of the beneficial bacteria, right? That could be loss of, let's say, intestinal microbiota diversity. That can also happen, right? Can also happen that we suddenly have an overgrowth of certain bacteria that are not beneficial, right? We can call them imbalance, or we can call them even harmful, some of them, right? So this is where there's an interesting study that I wanted to share with you. This is a situation when we call dysbiosis, right? If you have any one of those three situations, it's a clear example of what is referred to in studies as microbiota dysbiosis, right? So again, you can see that scale in the middle, right? And that scale essentially could mean several different things, right? I give you three examples, right? A reduction in beneficial bacteria that helps you to modulate inflammation, right? A reduction in beneficial bacteria that helps you to maintain healthy body weight, right? There could be multiple, could be the loss of diversity of some important bacteria, right? That can happen with antibiotics, for example, or as you change your diet to, or stress, ongoing stress. Could be multiple reasons for that, right? And so this is a really interesting study. It was published in the Journal of Signal Transduction and Targeted Therapy in 2022. And essentially, what the authors are essentially reported here is that with the advances in DNA sequencing, researchers are now able to focus on how changes in certain microbial communities relate to different diseases. And when the balance in the gut microbiome is disrupted, right, as I mentioned, by different things such as diet, stress, drugs, right, certain drugs, it can throw off the normal body function and contribute to the development of diseases. And so far, the studies that we have linked microbiota imbalances or dysbiosis to conditions such as heart disease, cancer, diabetes, inflammatory bowel disorders, brain disorders, kidney diseases, and liver diseases, as Dr. Esha mentioned, and even you can see different types of cancer here: lung, colorectal, pancreatic, oral cancer, and of course respiratory changes. And that's because, as we mentioned before, one, the changes in your gut microbiota, what happens in the gut does not stay in the gut. The changes in the gut microbiota very likely to impact the changes of the microbiota in other areas, such as our mouth, our throat, our lungs, right? So our skin even. So, and beyond that, there's the whole concept of postbiotics, which we're going to go into next, right? So that's an indirect way in which these bacteria, they secrete a certain compounds, and then they can impact either reduce or increase your risk of developing diseases. And when you're learning the functional medicine skills, right, and integrative medicine solutions like specific targeted supplements and dietary changes, you can help your patient to navigate through that and guide them towards better gut microbiome. So this is sort of like an important overview to understand how the gut plays a role in development of chronic diseases or reduce the risk of diseases. And this is where, I mean, it's such a as I mentioned, it's such a fascinating topic. And to know that we can impact our patients' health so much just by a few targeted recommendations. And this is really where we're going to start diving deeper into what are the differences between pre, syn, and postbiotics.
Yeah, so let's talk about it. In functional medicine, we talk a lot about the gut health. I feel like it's one of the main areas we're targeting. Whomever you're seeing, you're always working on the gut in some way, but not all biotics are the same. So if we take a look at this image from a 2024 article in the journal Food Production Process and Nutrition, we're going to see kind of how these categories are distinguished. So in this studies, the researchers are basically explaining the differences and impact that probiotics, symbiotics, prebiotics, and postbiotics have on food processing and nutrition. So you'll see here, probiotics are under this little icon, the live beneficial bacteria. Symbiotics are generally a combination of probiotics and prebiotics. Prebiotics would be the food for the probiotics, so like fiber constituents. And then you kind of see how these impact the gut microbiome. And after they interact with the gut microbiome, the microbiome creates these postbiotics, if you will. So this can include a myriad of different factors. So enzymes, proteins, lipids, organic acids, polysaccharides, and such. So, another breakdown of this, probiotics, again, the live beneficial bacteria, these are the actual microbes that your patients or you are consuming through fermented foods or supplements like lactobacillus, bifidobacterium species. The symbiotics combine the prebiotics and the probiotics in one product or in like a protocol. And the goal of this is to help the probiotics survive and thrive in the gut by giving them the food or the fuel that they essentially need. And then you have prebiotics are basically the foods for your beneficial gut bacteria. So these are, like I mentioned, fibers, plant compounds that aren't digested by our gut. Think about kind of fermented products as well. So also I would say, you want to think about like the most common prebiotics I see are garlic, onions, asparagus, green bananas is actually a really cool one that I love, inulin. And then like postbiotics, again, are the byproducts of the bacterial fermentation. So short chain fatty acids like butyrate is a really common one you hear about a lot in the literature. There are other short chain fatty acids as well. Enzymes, peptides, other compounds. These are what actually influence things like your gut lining integrity, inflammation, metabolism, and immune signaling. I would say that there are different indications for why you might use postbiotics versus probiotics versus symbiotics. I think it really comes down to like what we call the art of medicine and why you'd want to use those. For some patients, maybe you think, you do a stool test or you test their gut and you just kind of want to fortify what's already there with prebiotics. For some patients, maybe they need a little more intensive support. So you do a symbiotic. Maybe some patients only need a probiotic. And then some may need to focus on a few combination of some of those things, right? So that can include postbiotics. In practice, we're not just trying to add more bacteria, we're trying to improve the function of the entire gut ecosystem. And there's some interesting literature around if probiotics do or do not actually colonize the gut. For the most part, they tend to wash through the gut, but they can incorporate a lot of changes while they're there in the gut. But postbiotics can actually influence your gut in a different way. So just kind of the power of personalized gut therapy. And I've used all of these in practice, almost all the brands you can think of. And then some probiotics you target for specific issues. There's like a huge kind of movement in the Akkermansia world for metabolic health. There's different movements. You might use different microbes. You might use somebody suffering with GI issues or chronic diarrhea. So it really kind of depends on what you're doing and then what your end goal is. So with that being said, let's go ahead and take a quiz. So for the quiz, which of the following best describes postbiotics? A, live bacteria found in fermented foods that help colonize the gut. B, indigestible fibers that feed beneficial gut microbes. C, a combination of probiotics and prebiotics used to support gut health. Or D, bioactive compounds produced by gut microbes that impact inflammation, metabolism, and immune function. So I'll give you a few seconds to put your answer in the chat. All righty. So the correct answer is D, bioactive compounds produced by gut microbes that impact inflammation, metabolism, and immune function. These are postbiotics. So we'll kind of let Dr. Tall talk about why postbiotics are actually important for us.
I really appreciate, Dr. Esha, the talking about the importance of these and what are they, right? So now you have an understanding of when we use the term postbiotics, how is that different than probiotic, right? How is that different than symbiotic, which has essentially pre and probiotics, and how is it different from prebiotics, right? So these are all, as Dr. Esha mentioned, these are all tools. And the better you understand and you go into the more clinical aspects of it and how to use each tool separately, the better results you can get, and faster also, which is great for the patient because they're gonna love you even more for getting them to help them to improve their health and feel better. Really, that's why patients come to see us. They want to feel better, right? They want to have less pain, more energy. They want to have better quality of life, and the faster we can get them there, the better. And that's what we use. That's exactly what we use the postbiotics, right? Because postbiotics are sort of like the end result of the bacterial fermentation. After they've taken prebiotics, they fermented them, and now we get the end products. And those are practitioners who are looking for faster results. For patients who are coming in, they're struggling. This is one of the ways to do that, right? And it's really interesting topic, and I would say one of the main reasons why we chose to talk about it is because it's not talked about in mainstream medicine, but even in several functional medicine programs that I went to previously for the last, let's say, 10, 12 years, there wasn't really this topic was really not talked about much. The difference between prebiotics, symbiotics, and postbiotics, right? So this is why we're here, to talk to you about the clinical application of functional medicine. So let's talk about what do they actually do? What do we get when we introduce postbiotics to our body? So essentially, postbiotics, as Dr. Esha mentioned, are short-chain fatty acids, right? And you can see this picture here, which is really interesting. This is a picture that was published in 2022, and it's I really like this picture because it really shows you from the emerging scientific concept to really the clinical application, right? And this was published in the journal Frontier, but essentially, when we say postbiotics, we refer to short-chain fatty acid, such as butyrate, which is, you can see short-chain fatty acids, a third from the bottom. Those have immunomodulating and other functions, right? So they help us with glucose metabolism. They help us with insulin sensitivity. They affect the colon, the liver. They affect other parts of our body. There's even now studies that are showing short-chain fatty acids can actually cross the blood-brain barrier. You got different peptides which have antimicrobial. They help to protect us from infections or overgrowth of other harmful bacteria. You also have different enzymes that are really important in reducing oxidative stress, which causes damage, right? It's important for some postbiotics might be vitamins, right? But when we talk about postbiotics, we're mostly going to talk about short-chain fatty acids. And the importance is really in strengthening the gut barrier, making it very selective, make sure that only the things we want to cross into our body, whatever we don't want inside our body is staying inside the gut, right? Now, also reducing inflammation. We know that inflammation plays a role in so many conditions. right? So if your patient, for example, have type 2 diabetes, there are studies that showing that inflammation play a key role in type 2 diabetes. If your patient has cognitive decline, if they have chronic fatigue, if they have an autoimmune condition, if they have a cardiovascular condition such as arteriosclerosis, right? We know that inflammation is a key player, a major player actually, in all of these conditions. So this is why we want to ensure that we take care of the gut, right? So modulating the immune system is really, really important. And of course, some of these compounds can also support brain function and hormonal balance, which is, we're not going to get into that today because that's a very big topic that we talk more about in the functional weight loss program. So if you are interested in learning more about how does the gut microbiome and impact the hormones and how hormones can impact our body weight and how we can treat all of that, the functional weight loss program is now open. We're now opening the enrollment for the August class. So that's going to be super exciting. And we're going to be with you in the functional weight loss classes every Wednesday, like we are with you right now. We're going to be with you in the evening for an hour to an hour and a half live class. Every week, we gotta dive deeper into one root cause that leads to metabolic dysfunction or weight gain, and what are the specific treatment strategies? How do we test it? We're gonna go into peptides and neurotransmitters and hormones and leptin and all sorts of really cool stuff. And if you're interested in that, reach out to us. We'll post the link for it so you can get some more information about it, including the scholarship that we currently have for healthcare practitioners. So this is really interesting because essentially, unlike probiotics, which may or may not survive the gut environment, and also as Dr. Esha mentioned, once you stop taking probiotics, there are some indications that we already know of that those bacteria don't stay in our gut forever, right? They just leave, right? With the bowel movement, they're just going out of our body once we stop taking the probiotics. So once we want to get a faster, if we want to get a faster response, right? We want to help our body to provide support to the patient while we work on a root causes, right? Postbiotics in many cases are a faster and a better approach to helping the patient to come back and say, oh, doc, I've been taking the stuff you recommended. I'm already feeling less inflammation, I'm already feeling less bloated. I already feel this, I already feel that. My skin is maybe clearing a little bit more. I'm starting to feel better, right? So sometimes it's really important to get the patient a few wins, right, in the beginning of the session of the treatment, because we want to increase engagement, right? And if they keep coming to see you and they don't see the results they want to see, at some point they're gonna discontinue, right? They're gonna discontinue. They're gonna jump off to another practitioner, right? So the goal is really to help those patients, right? And it's better if you help them in your practice, right? And you offer this comprehensive approach. So now that we understand what postbiotics is, let's take a look at quiz number 2. Warm up with quiz number 2, which is postbiotics are produced by gut bacteria when they are fermented. Which of the following? So essentially, why does this bacteria in our gut, beneficial bacteria, ferment, right? Are they using digestive enzymes? Are they using proteins from animal sources? Are they using indigestible fiber? Are they using antibiotics? What are they using to ferment? Right, so I'm giving you a few seconds. This one is a simple and easy one, right? So the answer obviously is indigestible fibers, which is prebiotic. As we mentioned, prebiotic, there are some prebiotic products like inulin, and they are useful in some cases. In some cases, with some conditions, you can get really good outcome with just adding the prebiotic as a way to support the gut, the local gut bacteria, right? In some cases, if the patient takes or eats prebiotic foods, it can cause more side effects. So that's something that we're not going to get into today, the topics of prebiotics, but it's really, really important to understand, especially if you have patients with chronic conditions and patients with digestive conditions, right? So if your patient comes to see you and they say, I got acid reflux, I got bloating, I got stomach ache, it's really important to understand the topic of gut microbiome. It's really important to also understand the prebiotics, the topic of prebiotics, right? Because then we might want to add something or remove something from their diet to prevent those certain bacteria from keep fermenting, causing, bloating or gas or this uncomfortable sensation, right? So this is where I feel like, Dr. Asha, this is where we should kind of probably steer back into talking a little bit more about what is the role of postbiotics in really discussing like more of the clinical application, like give some example of, maybe some bacteria and how what they ferment and how is that beneficial, so we can get a better understanding of the mechanism, right?
Yeah, totally. So when we think about like clinical applications of postbiotics, we're thinking, where do we apply this? How do we apply this? How do we read certain tests to apply this? And Dr. Tall will talk about that in a bit, but we can focus on butyrate specifically. So in functional medicine, postbiotics are often integrated into broader GI treatment strategies because they have the ability to support both your localized gut functions and systemic health, like you mentioned, Dr. Tall, and how butyrate can impact brain health. So these bioactive compounds produced through microbial fermentation can help modulate inflammation, enhance the mucosal barrier, modulate the gut pH. When you modulate the gut pH, that can help kind of keep the pathogenic bacteria at bay, and also influence immune signaling. So one of the most well-studied postbiotics is butyrate, which is a short-chain 4-carbon fatty acid with wide-reaching benefits across the gut-brain, gut-immune, gut-liver, and gut metabolic axes. There are specific microbes in the gut that actually produce butyrate. You have your Eubacterium halii, you have your Eubacterium rectale, you have the Faecalibacterium prosnitzii. And so this is a little snapshot from a GI 360 test, and it's kind of a comprehensive stool analysis. And it tells you, hey, and sometimes when you do these tests with patients, you'll see, what bacteria they may be low in. They're looking at the stool. Sometimes they'll actually assess, the concentration of butyrate and things of that nature. And so you'll kind of see also this little description box kind of detailing what insufficient levels of butyrate are associated with when we look at GI health. And so in general, I want to kind of take a little bit of a deeper dive actually into butyrate. So outside of that, I want to take a look at this illustration from a 2023 study from the Journal of Clinical Nutrition, essentially summarizing butyrate's mechanisms of action. So you'll see here butyrate plays a role in maintaining gut homeostasis through various mechanisms. I always tell people, like, just like your car needs gas to run, your colon cells need butyrate to run. So as a postbiotic, it's specifically a source of energy for your colon cells. It activates the G protein coupled receptor for both your colonocytes and then local immune cells. So we can see that when you activate that G protein coupled receptor, you increase proliferation, you increase anti-inflammatory signaling there. There's an increased immune response to pathogens. So butyrate in and of itself, you'll see how it's kind of contributing to anti-inflammatory and immune modulating activity in the gut. And then we also see how butyrate has an inhibitory effect on the histone deacetylases, which is the HDAC. It's basically a group of enzymes in the body that has a myriad of different functions. But when butyrate is around, it actually will inhibit it, which leads to reduction in inflammation, regulation of gene expression involved in kind of cellular proliferation, differentiation, and such. So it's a really cool molecule in that it can have many cellular impacts in the body outside of us just saying, oh, it supports a healthy gut. So when you're talking to your patients about postbiotics, you can kind of explain, how they actually modulate different aspects of the gut and then the system in general. Postbiotics clinically, when you're applying them, can be applied for gastrointestinal disorders. So I've used them a bunch for patients that I've worked with who have IBD, IBS, patients with just kind of chronic functional disorders, metabolic disorders. When you look at the literature around the initiation and progression of metabolic disease, there's a lot of linking to the gut and the gut microbiome. So I'll use it there. Chronic neurological disorders. I was just reading a study about Parkinson's and butyric acid, which is butyrate, specifically impacting the system. And this was through oral supplementation. So yeah, there's some really cool targets you can apply butyrate to. And essentially, when we're targeting the gut, we're also reducing this like systemic stress. And like I said, the gut can be like a huge source of stress for the body, specifically through the increased intestinal permeability picture. So we kind of take a deeper dive into this when you kind of log into your dashboard and kind of sign up and get on a coaching call. We'll teach you more about these things, but it's really cool when you look at how these postbiotics can modulate your entire system through the gut. So
this is so important that you mentioned that. And I know that Dr. Esha, butyrate is such an important factor. There's actually supplements, right? There's supplements specifically that you can recommend and consider with patients that are specifically would just introduce butyrate into their body and have. So if you're looking for some of these benefits, physiological benefits for your patient that Dr. Esha was just talking about from this particular study published in the Journal of Clinical Nutrition, then you can look for those, and those will be, those would be like providing the end result of the bacterial fermentation, right? Instead of providing probiotics, which, they ferment the food we're eating, and which depends on multiple factors, right? I mean, your patient probably must eat specific amounts of fiber, right? And if they don't consume enough fiber, for example, that might be an issue, right? So here's another example why we would use postbiotics, which is really kind of bypassing this whole process and giving the patient, here you go, like here's the end result of here's butyrate, and this is what we know that it's intended to do, right? So that is so important. And we often say in the functional world, we use the term, if you're not testing, you're guessing, right? And while of course those tests, some of them are covered I would say many of them are covered under private insurance carriers and can be billed for insurance. A lot of them are cash, and some of our patients might have high deductible or it might not be covered under this plan. So we don't always want to test, but we do want to test when it's really indicated. It's like, okay, there's an autoimmune condition in the background. There's some sort of chronic ongoing struggle, right? And we want to figure out what's going on, right? Why is this patient struggling with excess weight? And we have signs and symptoms or indications that it might be the gut microbiome. And so in that case, testing instead of guessing is very important, right? And so let's take a look at a snapshot from one of the lab testing that you can look into. And this is the GI 360 test performed by the vendor Doctor's Data. And here, essentially, what you can see is on the top, you can see there's like diversity. It gives you like a breakdown of an overview of diversity of what type of the 6 on the top, what type of 6 beneficial and important bacteria you have less and what types you have more, right? And then you look at, in the middle, there's a dysbiosis and diversity index. So as we mentioned, if the dysbiosis index is higher, that indicative that there are 1 out of 3, right? It could be that there's bacterial overgrowth, bacteria, not necessarily beneficial bacteria. We got maybe loss of beneficial bacteria, right? And now we have less of the short chain fatty acids production, which is not a good thing. Could be also that we have loss of diversity, right? So that's where we have a diversity score. And this test is really great for giving us a snapshot of what's happening in the patient's gut ecosystem. And on the bottom, you can see there's key findings. So it'll give you like a summary of the butyrate. So for example, it's hard to see, but all the way on the bottom, it says butyrate low, right? You got propionate, you got acetate, right? So it gives you the breakdown of all these different postbiotics. And if they're low, that will be a very clear indication that this patient would probably benefit from a supplement of postbiotics, right? It also gives you indications of the inflammatory markers of in the gut or intestinal barrier health and function, right? So this is a really important. This is just the first page. From the second page, it really breaks down the amounts of those different bacteria and some more information about inflammatory markers, and also the amounts of these postbiotics. So let's take a look at the other picture. This next picture is taken from the same exact GI 360. And here you can see the intervals, the amounts of these different postbiotics, right? This is a simple test, stool test. You can automate it and have the patient order it. So if you're a lot of the nurses in our community, many of the PAs who do not want to practice primary care, or nurse practitioners in some states where they don't want to do primary care anymore, right? They will have the patient order labs for themselves, right? So a lot of the registered nurses, pharmacists who are working as functional health consultant that are in our community, they don't do primary care. So they don't technically diagnose and treat diseases. They educate the patient about what it is that is holding them back from restoring their health and feeling good again, right? And so your patients today across the United States, with the exception of New York, they can go online to Genova Connect or online to other websites and order GI 360 for themselves or other similar tests. And then they can see, for example, here you can see that the amount of valerate is lower, butyrate is insufficient amount. But in so many cases, patients, if they don't have the right bacterial composition, their diet is not supportive of these metabolites, production of these metabolites, right? Or they have dysbiosis, they will have lower amount of postbiotics. And at that point, it's harder to have a healthy metabolic function. It's harder to modulate inflammation. It's harder to metabolize our food properly, right? Because we don't have those essential byproducts that our body is designed to have, right? This is really why do we need those bacteria in our gut from the beginning, right? This is a symbiotic relationship that is created to benefit both of us, right? The bacteria eat some of our fiber and other foods, and they ferment to provide for us these postbiotics products that help us to maintain healthy function in our environment. So this is a really good example of how to assess your patient. And before that, I'll just mention something really important clinical. This is like a pro tip. The Academy provides you, each one of you in our community of the Advanced Functional Medicine program, provides you with a powerful clinical tool. This is called the Functional Health Survey. And this is the first thing we want you to do when your patient comes to see you and they're asking for guidance, right? Because when they fill it up, it shows you can see the signs and symptoms for each category of dysbiosis, bacterial overgrowth, nutritional deficiencies, maybe environmental impacts, right? It gives you the specific indication. So when you, the practitioner, look at the results of their survey, you can tell, oh, they got signs and symptoms of dysbiosis. They got signs and symptoms of SIBO. They got signs and symptoms of this, right? So it gives you a much more clearer path to review and evaluate their situation. And one, that saves the patient a lot of money on doing unnecessary testing, right? Two, it helps you to stay focused with your time during the evaluation, right? And so, of course, it doesn't replace you learning the mechanisms properly, but it is a powerful tool, and we want all of you to use it. And so now that we looked at the test, we looked at one of the testing options. let's dive into a little bit more into what type of product consideration you would want. As an example, Dr. Esha is going to share with us an example for a product that you can consider for your patients when they need that support.
All righty. So, of course, we are going to talk about butyrate again. So one of the most commonly recommended postbiotics, again, is butyrate. It's also really well studied. While it's naturally found in some foods such as butter, for some patients, they just may require a therapeutic dose of butyrate. And you wouldn't want to do a therapeutic dose of butter because I don't know what that is, but butyrate, just the specific molecule is a little better. So butyrate supplementation can help with targeting a therapeutic aspect or a level of this postbiotic. So this is a formulation or a product that consists of a patented form of tributyrin, which is basically like 3 butyric molecules, tributyrin. There are some really nice studies on tributyrin, and it continues to emerge with promising results for both gastrointestinal and extragastrointestinal non-GI disorders. And so I would definitely say this is one that I'm often using. It's one that's from a trusted company. And this is not a company that the Academy is affiliated with, but just a good product brand. And like I said, there's some really nice research about this specific molecule in animal models, human models, and specific disease models as well. And some of the studies, the doses are, just taken as directed. So I think for this formulation, it's about 300 milligrams per gel cap. It may be a little more than that, but some of the studies, they're taking 500 milligrams 3 times a day, right? So it's a pretty safe product to use compared to, say, some botanical products for gut health. This one's a pretty safe one. It's just a matter of like what you're targeting and kind of the duration. But this is one that we like. There are other ones as well out there. So in general, I would say there are many other tools that you can use for optimizing your patient's microbiome health. These include foods, diet, fiber, things of that nature, botanicals, nutrients, targeted compounds. To learn more about specific ingredients and products that can help assist your patients with their GI health, you're always welcome to log into the course dashboard in the Advanced and Clinical Functional Medicine Certification Program and revisit the modules. Also, booking a coaching call works as well. So yeah, that's one of the products we recommend, and there are plenty others out there, but definitely a butyrate postbiotics are great for supporting your patient's gut health.
Yes, we wanted to share with you this. While we were not affiliate, the Academy and the practitioners were not affiliated with a specific any specific supplement manufacturer, because that obviously would be a conflict of interest for us. Where when we recommend a specific brand or a specific product, we would typically recommend a professional grade product from a company that has good reputation, good manufacturing practices, and third-party testing. And this is product by Designs for Health. So as Dr. Esha mentioned, it's called Tributyrin Supreme. It's got a really good dosage of all of these different butyrate components. And this is, as we mentioned, this approach will not address the underlying factors, the underlying issues that could be dysbiotic or dietary factors, right? It is important for, again, supporting the patient so they feel better, right? Supporting them in reducing that ongoing inflammation, metabolic dysfunction, right? This is really important because while we work on the underlying root causes, we also want to help the patient to feel better and function better in the meantime, because, right, that increases engagement. Now the patient comes back and trusts you more. You're the health authority in the eyes of the patient, right? You're the person they chose to trust with their guidance when it comes to their health. So it's a powerful tool to use it when appropriate. And then, of course, one of the things that we also want to mention is that there's a lot more to learn about gut health. And of course, as Dr. Esha mentioned, log into the platform. Also, for all of you in our Advanced and Clinical Functional Medicine program, you have access to coaching with experienced practitioners who are using all of these different tools in their practice, right? So it doesn't cost you extra. This is a massive benefit. So use it. Log into the platform, book a coaching call, bring a case study. I've done myself. I took myself as a case study and filled up the health survey, and then did the coaching with an experienced practitioner to tell me what do they see in my health that need improvement. Then I took my father as a case study. He needed some help with his health concerns, right? So you can pick a real patient, you can pick yourself, you can pick a family member, a friend, but we want you to start developing that functional medicine muscle and use this approach to help people. There's a lot of people out there that need help, right? So use this approach. So book a coaching call. It doesn't cost you anything. You're in our community. It doesn't cost you anything. Just book the coaching call so we can get together and continue in developing your skills. And if you are interested in learning more about the root causes of weight gain, metabolic dysfunction, and obesity, we have an amazing program. We just opened the enrollment this month. We got a $2,000 scholarship for healthcare practitioners, and this is the Functional Weight Loss Consultant Program. We'll post a link here so you can check it out. We had amazing feedback on this program. We've been running several cycles of it. Most of the practitioners, most of the folks in this program are healthcare practitioners that work with patients who struggle with weight gain. And we got a lot of nurse practitioners that are using different weight loss tools. We got physicians and other practitioners who are maybe also prescribing weight loss medication, but they're looking to understand the root causes and provide a more comprehensive long-term solution to their patients, right? And we also have practitioners such as registered nurses and pharmacists and nutritionists who are looking for an alternative to the weight loss medication and really help focus on health and wellness and helping those patients to lose weight through addressing the root causes of weight gain. So if you're interested in more information, check out the link. And this was fun. I mean, I love talking. Both me and Dr. Esha love talking about.
Oh yeah, this was really enjoyable. I loved it so much. Yes. Butyrate's my favorite, so I was glad we could kind of shine a spotlight on that one.
Of course. And remember, there's a lot of different tools that we can use, but everything you're learning is just adding more to your toolbox. And this is where the coaching calls come in place, is really taking a real live patient, could be yourself, a family member, friend, or a real patient, and seeing how we can fit, which tool would fit to help yourself or somebody else,
Yep,
right?
That's right.
That's where, like, putting it more into a real scenario.
That's
Right. So this is why we're here. We're here to help you develop your skills. So check out the platform, or if you're interested in the weight loss, the best place to learn more about it is the Functional Weight Loss. And as usual, I really want to tell all of you how much I appreciate you for the work that you're doing for the patients. I want to thank Dr. Esha for being here, for sharing her clinical experience with us. I want to thank the media team and Jacob for making it all happen for us here. And on the technology side, helping us to also produce these classes and podcasts and connect us all. And I want to thank all of you, each one of you, for developing your skills, investing time and effort to develop your skills and help your community. That's really the best legacy we can have, to know that you're making a difference in other people's lives. So thank you again. Have a good evening in the meantime, and take care of yourself. We'll see you in the next class.